Abbreviations, Group A. The language of medicine incorporates use of abbreviations for ease and efficiency in written communications. In this class, we will learn some of the more commonly used abbreviations and their meaning. Abbreviations are found in Appendix B in your textbook. We will be learning abbreviations in 2 lessons during this course. Our first abbreviation, AC, means before meals. Where this comes from is in Latin, ante means before and sebum means food. So anti-sebum, AC, if a medication were ordered to be given AC, it would mean give that prior to each meal. PC, on the other hand, means after meals. This comes from Latin, post, meaning after, and again, sebum, meaning food. So a medication ordered to be given PC, post-sebum, would mean you would give that after the patient had their meal. BID means twice a day, TID 3 times a day, QID 4 times a day, PO means by mouth or orally, NPO means not by mouth, so do not give anything orally, and this would refer to food or fluids. HS means hour of sleep or bedtime. So if a medication were ordered to be given at HS, it would mean when the patient was ready to go to sleep. C with a line over it means with. S with a line over it means without. CAP, CAP, refers to a capsule. TAB, TAB, means tablet. IM means intramuscular and refers to giving something within the muscle or into a muscle, such as an injection. IV refers to something given within a vein, intravenous, within a vein, such as medications or a solution. R means rectally. PRN means as needed or as the patient requests. Often, physicians will order medications to be given to a patient on a PRN basis, meaning when the patient needs it, and often these are medications that are used to treat patient symptoms such as pain or nausea or diarrhea, constipation, etc. So they wouldn't be given routinely, but only if the patient needed or requested it. EC is an abbreviation that refers to enteric coating. Enteric coating is a coating added to tablets of medication so the medication dissolves in the intestinal tract rather than the stomach. The reason why we would do this is it's very useful for medications that might be irritating to the stomach lining. For example, aspirin is very irritating to the stomach lining. But if the patient would benefit from aspirin and we enteric coated that aspirin, the aspirin would dissolve in the intestinal tract, not in the stomach. The patient would then gain benefit from the aspirin without it being uncomfortable for the patient by the irritation it could potentially cause to the stomach lining. Q means every, H means hour. So if something were ordered to be given Q2H, it would mean every 2 hours. Q4H, every 4 hours. Q6H, every 6 hours. Q8H, every 8 hours. Q12H, every 12 hours. QD would mean every day, meaning once a day, every day. And QH means every hour, which would mean 24 hours if it were if something were ordered to be given every hour. So what's the difference then between the following orders? Because they look similar, they can be confusing. What is the difference between BID, which means twice a day, and Q12 hours, which means every 12 hours? They both sound like they would be done twice a day, which is true, But BID means twice a day during the patient's waking hours, and you can see that waking is bolded there. For example, 8 o'clock in the morning and 6 o'clock at night, when the patient is absolutely awake. Whereas Q12H means twice a day, every 12 hours exactly. So in other words, you would give it 8 o'clock in the morning and again at 8 o'clock at night, exactly every 12 hours around the clock. TID versus Q8H, how do these terms differ? Well, again, TID means 3 times a day during the patient's waking hours. So, for example, a medication ordered TID would be likely given at 8 o'clock in the morning, again at 1400 hours, in other words 2 o'clock in the afternoon, and then again at 8 o'clock at night. Whereas Q8H means given 3 times a day, given exactly every 8 hours. So if the medication were given at 8 o'clock in the morning, it would be given again 8 hours exactly later at 1600 hours, 4 o'clock in the afternoon, and again exactly 8 hours after that at 2400 hours, which is midnight. The difference between QID versus Q6H, again, QID means 4 times a day during waking hours. For example, a medication ordered QID would suggest this medication would be given only during waking hours of the patient, so 8 o'clock in the morning, noon, 4 o'clock in the afternoon, and again at 8 o'clock at night. Whereas Q6 hours means 4 times a day given exactly every 6 hours. This order would mean this medication would be given, for example, at 8 o'clock in the morning, then exactly 6 hours later, so at 1400 hours, 2 o'clock in the afternoon, then again exactly 6 hours later at 8 o'clock in the evening, and exactly 6 hours after that, which would be at 2 o'clock in the morning. Further abbreviations: STAT, stat means immediately, do this as quickly as you possibly can. SC means subcutaneous, under or below the skin. SQ means subcutaneous, under or below the skin. Both these abbreviations mean exactly the same thing, SC and SQ. SL means sublingual or under the tongue. ID means intradermal or within the layers of the skin. Now it's time to practice the abbreviations you have learned in this lesson. Remember, memorization requires repetitive practice and review. As we've learned before, flashcards are very helpful in any kind of rote memorization. Have a family member or friend quiz you with the flashcards you have made. If you have any questions, please feel free to contact your instructor.